Hello and welcome to the second episode of the ALO Bariatric. My name is Denise Campaña and today we're going to talk about the benefits of bariatric surgery. Today we're here with Dr. Hilke and he's going to explain to us what the long-term benefits are.
Hello everyone, how are you?
Thank you for being here with us today.
No, don't worry about it. Like I said, I love this.
So on the last episode, you explained us what the differences of the bariatric surgeries are, and we had pending what the benefits are from weight loss surgery or bariatric surgery. So why don't we start with that?
Okay, that's a perfect point. I do remember we had one answer pending.
Mm-hmm.
Like I told you on the last episode, this was going to be a little bit longer, and that's because there is a lot of things to cover. Obviously, remember that there are too many things, so we're just going to cover like the major points.
Let's start with the most common question. How does this benefit with that diabetes?
Okay, well, as some of you might know, diabetes is a worldwide problem. It basically interacts with the sugar on the blood. The medical term is glucose, and these people usually have a problem with using the glucose. Okay, we're not talking about diabetes right now, we're talking about the benefits. So in simple terms, the main benefit from this surgery is that it will help people control diabetes in the long term. The way it does that is by different mechanisms, but the most important mechanism is weight loss. When people are too overweight, they start secreting a lot of hormones that interact with the glucose control in the body. So that is why this surgery helps with the long-term control of diabetes. It will also ensure that people might not require insulin in the future. And if people require to use insulin, the most likely scenario is that they will be able to reduce the levels of insulin that they need and also other medications for diabetes.
So how does the surgery comes into this?
Well, basically the surgery comes into this because after getting bariatric surgery, you will lose weight. The decrease of overweight will help you control the levels of glucose in your body.
Okay, so the first benefit is having that diabetes controlled.
Mm-hmm.
So what's the next benefit?
So one of the other great benefits of this is improving cardiovascular health. That means the health of the heart.
Okay, that sounds important. Can you explain what that is exactly?
Yes, cardiovascular health relates to the health of the heart and basically all the arteries and veins of the body.
And how does the surgery helps with the heart?
Well, first of all, and we're going to be repeating this quite a lot, so please guys remember that all of these benefits are related to weight loss, okay? So with the decrease in overweight, as I said before, there are also hormones that interact with the blood pressure in the body and with cholesterol circulating around your arteries. Also, when a person gets this surgery done, the main goal is that they change their lifestyle. So in improving their diet and in improving their exercise, it will help tremendously. It will basically reduce the risk of having a heart attack.
Well, that sounds fantastic. So people can actually think about having a better lifestyle and a better life and also thinking about living more.
Yeah, basically, I mean, this surgery will give you better opportunities to live longer, at least when it comes to your heart and your general health, totally.
Okay, so this surgery will help you to live longer, being healthier, and also, I'm guessing, being happier?
Yes, actually, another important topic that this surgery interacts with is depression. It has been scientifically proven that around 33% of people that just come to get surgery done get rid of their depression. And then with the extended weight loss, 16% more get rid of their depression. Because a lot of people are really self-conscious by the way they look. So if they are not comfortable with the way they look, they tend to isolate themselves. They don't like to be with others. So they start getting depressed because they're lonely all the time. After they get this surgery done, they start going into support groups, meeting other people that had the surgery done. Like us, we have a support group online. So they start building new bridges and new friendships that help them overcome this problem.
I'm glad you mentioned about the support of other people, because we do in fact have a Facebook group where we can all see the changes and the experiences from our patients, and I can actually see all the improvements that my patients have done after surgery. And new patients, new people interested in weight loss surgery, they can see all the things that they will be able to achieve once they start this journey.
Yeah,
So,
and it's interesting to see how every single person in that group agrees that they should have done it sooner.
it's the only thing they regret, not doing it sooner, to be honest. Some patients have mentioned the problems they have with the knees, joints, pain. So how does this surgery help them with that
Okay,
problem?
so it helps them in a ton of ways. First of all, if you are a candidate for a hip replacement or a knee replacement, you cannot be above a certain size. So there's a ton of people in the USA waiting to lose weight so they can actually get a new knee or a new hip. So you're talking about people that have to be using wheelchairs, having to lose weight, not being able to, and they cannot get their life back. So a lot of people come to our clinic to get the surgery done so they can lose weight, so they can get their hip and their life back. That is the thing that we see the most common.
I actually had a patient that came from Canada, that he was a candidate for surgery in Canada, but he had to wait 3 years. He obviously didn't want to wait 3 years because he needed a hip replacement. So losing weight was like the first thing that he had to do before doing that. So he looked online, he found us here in Mexico, and he was like, I'm gonna give them a chance. We got in contact, and he already had his hip surgery, and he says that the care here was, top notch, as people say. And then he's glad he didn't wait the 3 years that he had to wait in Canada for doing, first of all, weight loss, and second, to get the hip replacement.
And yes, that's totally a really common story that we hear all the time, at least from a lot of people coming from Canada, where they know they will get the procedure, but not everybody has the time for waiting 3 years to get, your life back.
Another question that I think it's important as a woman, and because I received this question many times, a lot of women are scared because they plan to have kids in the future. So I always tell them that, on the contrary, this surgery will benefit, but can we go more in depth about how it's going to benefit them?
Yeah, of course. I mean, like I previously said, overweight affects a lot of things in the body, if not everything. And a common problem is that the hormones start acting bad. They basically go out of control. In fact, you can talk about it with your patients that they most likely have really weird rhythms when it comes to their menstruation. So whenever we do this surgery, by controlling and regulating their hormones, they will actually get pregnant easier if their problem was related to the overweight. And a really important thing that you should know, and you should know, is that this will make your pregnancy healthier. And this will actually give your kids a better future. It has been proven, scientifically proven, that the better the health of the mother, the better the health of the kid. So we will be reducing the possibility of that kid having really bad genes for diabetes, high blood pressure, and obviously obesity. So it's a really good choice for any future mother watching this show.
I actually had a patient calling me just to tell me that she got pregnant after surgery. And to be honest, that small detail made me realize how great this job is, because we are able to help people achieve, what they have always wanted after surgery.
Yeah, I think that is something that we as medical professionals deal with every day. Just knowing that you were able to change a life, it's priceless.
So let's go on then on the next topic because it's a long one.
Okay, I think the last thing that we can talk about today is sleep apnea. I don't know if you've ever heard the term.
I have heard patients mention sleep apnea and being one of the reasons they want to lose weight.
Yeah, I mean, sleep apnea is basically, it's a diagnosis. It has to be diagnosed by a machine. It basically measures how well you sleep. When people increase in weight and become overweight or obese, they will also increase in the amount of fat in their necks. So that's why when they're laying in bed at night, the airway is not as effective anymore. So they basically stop breathing in the middle of the night. The most common symptom is basically snoring, like really bad. These people are people that wake up in the morning, they say that they are tired, they didn't have a good night's sleep, they feel like everything is dry, they're cranky in the morning, they don't like waking up.
I was aware about sleep apnea, but I didn't know exactly why it happened.
Yeah, I mean, I think it's something that everybody just laughs at, like, oh, he snores or they snore. But in some cases, some people are actually having problems with it. So if you lose the weight with bariatric surgery, you will lose the fat around your neck, making your airway more effective. So this basically can cure it. A lot of people will get rid of their CPAP machine or their BPAP machine, which if you use one, you know what I'm talking about. And this is definitely a really good choice for you.
Yeah, actually, whenever patients mention sleep apnea, it's pretty normal that they use a CPAP machine. And I do mention that they can bring it with them. Some people think they cannot take it with them on the airplane, but they can. And it's better if they do bring it.
Yeah,
so they can use it at the hospital and at the hotel.
Yes, because at the end of the day, they have to travel to the clinic. So in those days before, they should totally use the machine as they were using it.
Probably the last couple of times they're going to use it, but they need to bring it.
Yeah, they do.
So I think we're running out of time once again, but can you tell us something else, about the benefits before we finish this episode?
Yes, there's a ton of benefits. People don't grasp the idea on how big of a change this is. This will change your life completely for the better. There are a ton of topics that we will cover in the future in this show, but it has to do with gastrointestinal problems, autoimmune disease, osteoarthritis, arthritis. There's a ton of problems that this solves.
Well, thank you, doctor, for being here with us today once again, and I hope we can do another video so we can talk about the other benefits about bariatric surgery.
Don't worry about it. I do it gladly.
Thank you once again for watching our newest episode of the ALO BariShow. If you have any questions, please let us know in the comments, and we will gladly answer all the questions that you might have. My name is Denise Campaña, and this was the ALO BariShow.